Hi, yeah. 9 years ago, when I fell out of my window, I fell on my left side out of a second-story window. Not only did I have a severe traumatic brain injury, but I broke my neck. I broke 5 ribs on my left side. I broke my pelvis in 3 places, ruptured my bladder, punctured my lung, and I was in a coma for 2.5 months, and I survived. I went into therapy after I came out of my coma, and after ICU, I went into rehab, and after I got out of rehab, then I went into physical therapy. I was in physical therapy outpatient for 6 months. After my limitation was up, they released me, and I went home. And for the last 8.5 years, I've had to do physical therapy my way, which has been wacky ducky my way, which has been motivation bug my way. Weird things that have just been things that made sense to me, that just kind of got into my mind, and I just went with it. Whether it be going out to cut my grass, where I was sitting on my butt, grabbing a bunch of grass in my hand and chopping at it with a bread knife to cut a bunch of grass, boot scoot a little bit on, grab another bunch of grass, cut it with the bread knife, and keep boot scooting along until I got it done as best as I could for it to at least look like it was done. I'm sure I looked a sight to anybody that saw me, but it was okay for me. Well, I just went and did that again today. But I do these kinds of things because they're good physical therapy my way. And I continue to do them because I don't have physical therapy per se. But I don't stop moving. I don't stop continuing to do exercise. As you can see, broken neck, I'm fine. I can get up and boogie with the best of them. Hey, everything's doing fine. But I just wanted to say that no matter what they say or label you with, there's nothing that we can't do as long as we get our minds set and say, okay, it doesn't matter what they say we can or can't do, we can keep doing it because we get in our minds that we can. And that's where we get the motivational bug. It's like a little whisper in our ear that says, you can. Keep going. Keep doing. And you can get there. Doesn't matter if you're boot scooting boogie on the floor just to get there. Doesn't matter if you belly crawl to get it done, because I've done that. But you just gotta keep going. Lean, hold on to get yourself, bang into things, get bruises. The whole works, but it gets you going. And every time you get an ouchie, it's called good pain. If you're doing something to try to get something done, when you hurt, it's called good pain because it's the body responding to getting things done, and it's helping you get a little further the next time. So those are good pains. Just wanted to say hi and talk to you later. Later, Gators. Bye-bye.